Today, we're going to dive into a landmark study that really truly changed the game in the fight against advanced lung cancer. And this isn't just about some new drug, it's about a revolutionary new idea. An idea that was put to the ultimate test and ended up having a huge impact on patients' lives. And it all starts with this question. What do you do when the treatments just stop working? For thousands of patients every single year, this is a terrifying reality. The first line of defense has failed, the cancer is growing again, and honestly, the path forward gets really uncertain.
And that path has been especially tough for patients with something called advanced, non-squamous, non-small cell lung cancer. Yeah, I know, it's a mouthful. We just call it NSCLC. But the point is, it's a very common and historically very difficult form of the disease to treat.
For years, when those initial treatments failed, the go-to option, the standard of care, was a powerful chemotherapy drug. Now, it did extend life, which is huge, but it came at a tremendous cost. We're talking about a grueling therapy with really severe side effects and, sadly, pretty limited long-term success.
So, this is where things get really interesting. Researchers decided to set up a head-to-head clinical trial. Think of it like a direct showdown between the old standard of care and a completely new approach that worked on a fundamentally different principle.
So, in one corner, you've got Docetaxel. That's traditional chemo. You can think of it as a controlled poison designed to kill any cell in the body that divides quickly. Now, that hits the cancer for sure, but it also hits a lot of healthy cells, which is what causes all those tough side effects. And in the other corner, you have the challenger, Nivolumab. This isn't a poison at all. It's an immunotherapy designed to wake up the patient's own immune system and basically unleash it on the cancer.
So how does a drug like Nivolumab actually work? Well, it's what's called an immune checkpoint inhibitor. You see, cancers are pretty clever. They can actually step on the brakes of our immune cells, telling them to just stand down and ignore the tumor. What this drug does is it essentially releases those brakes. It takes the foot off the brake pedal, and suddenly the body's T cells are free to do what they're supposed to do, hunt down and destroy the cancer.
Okay, so the stage is set. You've got poison versus the body's own defenses. And in any cancer trial, there's one question that matters more than anything else. Which treatment helped patients live longer? So let's get right to the bottom line. The results were just definitive. Patients who got the immunotherapy had a median survival of 12.2 months. Compare that to just 9.4 months for chemotherapy. That's an extra 2.8 months of life on average. And let me tell you, in the world of advanced lung cancer, a gain like that is a massive leap forward.
And this survival advantage wasn't just about the average either. Take a look at the 1-year mark. 51% of the immunotherapy patients were still alive versus only 39% of those on chemo. That's a huge 12-point gap. More people were living longer.
And then, if you push it out even further to 18 months, that gap gets even wider. You've got 39% of immunotherapy patients still alive compared to just 23% in the chemo group. So this wasn't just some short-term boost. This was a durable, long-lasting effect.
So if you put it all together, it boils down to this. Patients who were treated with Nivolumab had a 27% lower risk of death. It was just a clear, decisive victory on the single most important metric there is.
But, survival is only half the story, right? The quality of that extra time is just as important. How did patients actually feel on these two totally different treatments? This is where the comparison of side effects was just as crucial.
So on the one hand, you have the classic, harsh side effects of chemo. It wipes out your white blood cells, causes severe fatigue, nausea, hair loss, just really tough stuff. On the other hand, the immunotherapy side effects were different. Yeah, there's some overlap like fatigue, but a lot of them were related to the immune system being activated, like a rash. But the real difference maker was in the severity.
And just look at this number. It is absolutely staggering. More than half, 54% of the patients on chemo experienced severe grade 3 or 4 side effects. And on immunotherapy, only 10%. That is a monumental difference in what the patient actually goes through. So not only were patients living longer, they were living better while they were in treatment. So here's the final scorecard from the whole trial. Nivolumab won on survival. It won big time on how long the response lasted. When it worked, it kept working for over 17 months versus less than 6 for chemo. And it won decisively on safety with way fewer severe side effects. A clean sweep. So you see, this trial wasn't just a win for a single drug. It was really proof of concept, It signaled the beginning of a whole new era in how we even think about treating cancer, moving away from this brute force poison idea and toward a much more intelligent, targeted approach.
But buried inside all that data was this fascinating little puzzle, which is highlighted by this quote from the study. Patients on immunotherapy lived significantly longer, but their tumors didn't necessarily stop growing any faster than the chemo group. So how is that possible? It suggested a completely new way of thinking about this, that maybe just stopping a tumor from growing isn't the only or even the best way to measure success.
And that puzzle actually led to another huge discovery. The researchers found a biomarker. It's a protein on the surface of tumor cells called PD-L1 that could help predict who would benefit the most. It turned out the more PD-L1 a patient's tumor had, the better they responded to the immunotherapy. This was a massive step towards personalized medicine, moving away from a one-size-fits-all approach and toward treating each patient's cancer in a way that's unique to them.
So what's the big takeaway from all this? Well, this one clinical trial provided powerful, undeniable evidence for a paradigm shift. It showed that for a lot of patients with advanced lung cancer, the best weapon wasn't a chemical poison at all. It was a strategy to unleash the incredible power that's already inside their own immune system.
And that really leaves us with this profound and honestly very hopeful question. After decades of looking for external weapons to kill cancer, maybe, just maybe, the most powerful key to fighting it has been inside our own bodies this entire time, just waiting to be unlocked.